Hello everyone, welcome back to the Pharmacology Masterclass by Dentospedia. It is one of the trusted platform for dental board examination preparation. So the topic for today is geriatric patient protocols. What do you mean by that? We are talking about the elderly patients. So also when elderly patients comes to your clinic for a treatment, you also need to have some protocols that you have to follow, and also there are various factors that are related that why we want to give such drugs and why some of the drugs are very much contraindicated. So let's understand this in a very brief manner. So let's start. Geriatric dental patients are commonly defined as individual aged 65 years and older. So basically, these are the elderly patients whose age is 65 or more than 65 years. Presents a unique pharmacological challenges due to age-related physiological changes and the presence of multiple chronic conditions and the frequent use of multiple medications, that is polypharmacy. Because as we age, we have tens of pharmacology action that is going in our body and varieties of problem that occur with age. So because of it, the elderly patients are, it's been noted that they have been more susceptible to polypharmacy, that is taking multiple medication of same or different problems from different types of shops. So multiple medications issue is very common for elderlies. These factor increases the risk of a drug interaction, side effects, altered pharmacokinetics, and potential complication in the dental chair. This chapter will explore the core principles of the geriatric pharmacology with a strong focus on a dental implication, safe prescribing, and clinical risk management. So, aging and pharmacology. So, age-related changes in the elderly, such as reduced kidney and liver functions, altered body composition, heightened CNS sensitivity, significantly impact how the drug are absorbed, distributed, metabolized, and eliminated. That is, the pharmacokinetics is being altered. This shift can increase the risk of adverse effect and altered medication effectiveness. And for dental practitioners, this means doing more conscious, that they have to be very much careful and monitor more frequently and drug interactions and carefully consider, especially in the patient on multiple medications. Now, what are the changes that we see in a geriatric patient? First is the GI tract. In GI tract, you will see decreased absorption speed, increase in the gastric pH, also acidity, acid reflux are very much common. Delayed onset of the oral drugs. Oral drugs, as we have learned it in the basic of the pharmacology, the oral drugs basically first go to the GIT. So delayed onset of the oral drug because of the increased gastric pH and decreased absorption. Liver will have decreased hepatic flow, decrease in the CYP 450 activity. So this is responsible for the metabolism. So in the slower metabolism, increase in drug level in the blood. And kidney decrease in the GFR rate, decrease in the tubular function, so decrease clearance of the drug, increase in drug half life, more the drug will be there in the body. Cardiovascular decrease in the baroreceptor sensitivity, that is increase in orthostatic hypotension risk. This you will be learning in physiology. This is responsible in maintaining the blood pressure in our body. So it will be decreased. Then if it will be decreases, there will be increased chance of orthostatic hypotension, because when there is decreased blood pressure, baroreceptor is activated and our body try to compensate it with increase in blood pressure. So this will be also compromised. CNS you will be seeing increase in blood. This is blood brain barrier permeability, decreased dopamine is a happy hormone, so decrease in dopamine, increase in CNS sensitivity to sedatives and opioids. Okay, so increase in blood brain barrier permeability means more and more drugs will be going to the brain and it will hamper the brain. So increase in CNS sensitivity to many of the drugs, especially the sedatives and the opioids. Body composition, decrease muscle and increase fat is seen. So lipophilic drug accumulate. that is diazepam. Lipophilic is that the lipid loving drugs. So more and more fat will be there, more and more lipid will be there in the body. So the drugs will get accumulated to that fat composition. So this is also one of the most common issue. So clinical tip is that always start low and go slow when prescribing elderly patient. What do you mean by this? You have to start with a low dose, okay? First start of any medication, try to give the lowest dose as possible, and also the slowly, that don't give the medication rapidly, that you have to take 3 times a day, 4 times a day. Try to keep it as minimal and possible. Now polypharmacy, this is one of the main concern for elderly patients. Polypharmacy is very much common in older adults with a chronic illness and heightened risk of adverse drug reaction, interaction, cognitive issue, and hospitalization. In dentistry, it's a challenge like increased bleeding, altered drug metabolism, dry mouth, complications with anesthesia, sedation. Recognize it is it causes and consequences. Help dental professionals safely assess and manage the medication related risk in the elderly patients. Now, what is the definition of the polypharmacy? Polypharmacy means concurrent use of five or more medication. Okay, so this is the criteria, that it should be five or more than five medication should be there. Less than five medication is not considered at polypharmacy. Prevalence is high among elderly dental patients with conditions like hypertension, diabetes, arthritis, cardiovascular diseases. Common risk are the adverse drug reaction due to multiple drugs, drug interaction, medication non-adherence, increased hospitalization risk because more drugs, more side effects, cognitive decline because we have seen increase in blood brain barrier is there, so increase in CNS sensitivity to varieties of drug. So basically this is the polypharmacy and these are the risks that is associated with the polypharmacy. Now, what is the dental inside? Elderly patients may take antihypertensive, anticoagulants, antidiabetics, psychotropic, NSAIDs, all with the major dental implications. Okay, so these are the drugs that elderly patients can um, be using because these are the most common issues, and also these are drugs that can be given with all the major dental implications. Now, Beer's criteria. This is one of the most important thing in this chapter, and appropriate medication in elderly. The Beer's criteria, published by the American Geriatric Society, outlines the medication potentially inappropriate for older adults due to the high risk to benefit ratio. So this criteria will tell you that which drug is not appropriate for the geriatric patient because they are having high risk rather than benefiting the patient. Now, common beer listed drugs, dental prevalence, according to the dental that we use. The drug class is that diazepam, alprazolam. It is a benzodiazepine class. That concern is excessive sedation due to increase in blood-brain barrier probability. Falls because increased CNS sensitivity, the patient may fall. And safer alternatives can be short-acting anxiolytics like lorazepam. You can use short-acting is very important because we have seen you have to start low and go slow. This is the just a mnemonic type for your prescription in geriatric patients. I mean, amitriptyline, anticholinergic drugs. So anticholinergic effect will be there because we have seen cholinergic drugs responsible for parasympathetic nervous system. So anticholinergic, that it will block the parasympathetic nervous system. So it will safer alternatives will be SSRI, that is the selective serotonin reuptake inhibitors like sertraline. It is one of the newest drug. It can also be used in that. NSAID example, ibuprofen, GI bleed, kidney injury can be there, very much potent for elderlies. So you can give acetaminophen short time in the safe of all. Diphenhydramine, that is having the anticholinergic and confusion. It is also very much common because we have seen it is a generation one antihistamine, so sedative action is there. So you can give with the second generation, that is the loratadine. Meperidine, that is a opioid. Neurotoxicity will be there, respiratory depression can be there, so avoid that. Use hydrocodone with caution also because opioids, you must have noticing that we have come to the 21 chapter, we have talked about the opioids very much. So opioids, it's something that is very having a very addictive potential, so it is very much uh, ad- adequate that you should give opioids in a very low and in a very specific condition, because you should use NSAIDs more than opioids in any kind of patients, because opioids is something that is having a addiction potential. So it's better to use NSAIDs, and that to paracetamol if you are confused in the systemic condition of the patient. So thank you so much for watching. I hope you liked the video, and please download our app Dentospedia for more structured and curated module for pharmacology. Not only pharmacology, every subject you will be getting here in a very structured format, from video lectures to quizzes to mock tests to everything that you need for your examination that will ace your preparation. So thank you so much and happy learning.